one of the few good things in Obamacare was a regulation that required hospitals to give you a price list. They are avoiding it. My friend Paul Seegert is a healthcare advisor and a healthcare expert out of California, which is confusing to say the least. We'll start with that, Paul. You have to work in a state that has like probably the most government regulations in the world. It's crazy.
Sure is. I'm in the escape mode, though. I got a place in Nashville, so I'm actually coming to you from Nashville today, and my goal is to spend more and more time here.
Good plan. Well, let's start with this. Apparently, last time you and I talked, we talked about how there's new transparency rules for hospitals, and that this is a good thing. Mm-hmm. It actually says, hey, we're going to have price transparency. Customers, consumers, i.e. patients, get to see what different things cost. The problem is, apparently, hospitals are ignoring it. This is one of the few good things in Obamacare. It actually requires hospitals to post prices of their services. But you guys have found that they're not following the rules. What's going on here?
Yeah, it's a great storyline. This is one of my favorite things to be talking about right now. What we need the most in our healthcare system is transparency so that this powerful force, the American consumer, can actually do what it's good at, what we're all good at, and consume effectively, and which results in higher quality, lower cost things, healthcare in this case. We don't have a free market because there is not transparency, and we've trained consumers to consume in terms of copays and deductibles that have, in most cases, absolutely no relation to the cost of the procedure. And there's no awareness on the part of the consumer that the cost of that procedure behind the curtain of insurance can vary wildly while still being an in-network event that they're paying the exact same copay for. And we can talk more about that in a minute. But what we saw, and what we'd hoped would occur with this rule, to your point, one of the very few really strong parts of Obamacare, was that it would bring some of this transparency, and hospitals would share their pricing on 300 common procedures. Now, it revealed something that is really kind of highlights how crazy our system is. The average hospital has more than 150 prices for every procedure they perform.
Wait. Hold on. Let's stop that. 150 different prices for the same procedure?
That's right.
So, compare that to Best Buy. If you went into Best Buy and you said, how much does this 75-inch TV cost? And they said, well, let's pull out the book here, because it has 150 different prices. Yeah,
I can't tell you until I know a little bit more about you. How much money do you make? How big is your employer? All these other questions then would unfold. If we were to make Best Buy work like our healthcare payer situation now, they would then ask a bunch of questions about you, find out where you work, if you do work, who's paying, is it the government, is it a private payer, are you a cash payer? And then they would, at the end of that process, tell you a price. And let's say you paid $25 for the TV, and then the next person in line paid $2,500 for the TV. And that is occurring every single day in facilities all across this country. I was looking at an employer in Dallas. You could go, they had a Blue Cross Blue Shield plan that it matters. It kind of behaves the same for all of these retail plans. But you could go in network within 25 miles of the headquarters of this employer and get an MRI. Your copay with this plan would be $100 for the MRI. You could go to the low-cost facility if you knew which one it was, which you wouldn't unless you had some assistance, most likely.
Right.
It would be $700. So that is what the plan would pay. The plan would pay $700. You'd get an MRI. You'd pay $100. And at the high-cost facility, which is the facility built right outside the Cowboys practice facility,
right,
it would bill your plan $7,000.
Jeez.
And somehow, then you have to scratch your head and say, why would the Blue Cross Blue Shield plan allow that? Because quite simply, the way the rules work, the insurer gets to keep 15 cents of every dollar you send them. And the rest is, they have to spend on a claim. So they actually do better. There's kind of perverse incentives there. Medical loss ratio rule that was part of the ACA.
So the more inflated the price is, the more of the money that they pay out
that
comes in, they get. more of that
Yeah,
money.
they just get in a debit accounting position with their clients, tag on an increase each year. So they do better if the costs go up. Insurers do, hospitals clearly do. And so you've got this, but kind of back to the hospitals. I mean, you've got this situation where they've got more than 150 prices for every procedure they perform. They did not want that to become widely known. And they also don't want to have to compete in terms of price. They're very, they don't want those kind of market forces involved.
Right.
Because we know what would happen. I mean, then people could actually consume and say, okay, what we really should have that's very easily accessible is not only cost information, but quality information. I mean, quality is so important in this. We see it can be this extreme. You could have a surgeon that does knee replacements Monday, Wednesday, and Friday at one facility and in a city, a hospital. And then on Tuesdays and Thursdays, he's at another hospital, all in network for your health plan. And unbeknownst to you, if you go to the hospital where he works Monday, Wednesday, and Friday, or she works, your plan would pay $120,000 or $141,800 for this knee replacement. But if you go on Tuesdays and Thursdays to this other facility, you could get that same knee by the same surgeon, and you could have it at $42,500.
That's insane.
And that's occurring every day all around the country throughout our system.
And
so
my understanding is that the price because this is non-compliance. I mean, these hospitals are supposed to be, and we're talking with Paul Seegert, healthcare industry expert. They're supposed to be telling us what these procedures cost. The reason why they can get away with this is because the penalty for non-compliance is like $300 a day, which that'd be a lot for you and me if we had to, dole out $300 a day for something. But for a hospital that can charge as much as $101,000 for a joint replacement to somebody and $22,000 for someone else, that $300 a day fine doesn't mean squat.
It's not even a rounding error. And here's the problem. I mean, it was part of the original ACA, and somehow it took 11 years to get this part of the ACA implemented.
Wow.
And then when they did implement it, the fines, to your point, are so you might as well not even put a penalty. It's just
right.
These hospitals, many of them, we're talking to billions in revenue.
Right.
So, I mean, I was looking at the breakdown for one hospital. We can pull this data on any hospital, and we pulled it on one. It just so happened it doesn't even matter where it is because the numbers are big everywhere. But the cost to run the facility, all in costs, including their high-performing, high-dollar physicians and surgeons and so on, all in cost was $750 million. Their billed charges that year were over $11 billion. So their cost to charge ratio was 6-point-something%. Their costs only represented 6% of what they charged. Now, I know somebody's listening. They're going to say, well, yeah, but they don't get every charged dollar in house. That's true. I totally agree. I acknowledge that. But they get way more than $750 million in that hospital's case.
Right.
They're doing very well. There's hospital systems that have posted their biggest, most profitable years coming out of a year when they had their beds were all empty. So they're not, especially larger hospital systems, are certainly not suffering. And this $300 fine is $100,000 in a year to an organization that, bills $11 billion. There's really no need to comply.
Wow.
And others that are complying, go ahead and try and, it's supposed to be an easily accessible, downloadable file, So then there's some who are complying, but it's not useful information to an average consumer.
Right.
You don't really have a downloadable file that you could even understand and read. I would have to go to somebody in my office who does nothing but that kind of thing every day and say, what does this all mean?
Right.
And then you have other cases where they've complied as kind of the word's escaping me, but basically as a formality.
Right.
They've complied, but then they're going through the efforts of having it suppressed when you search it. Right. So it doesn't show up in the Google searches.
Jeez. So
it's incredible.
The problem with this, obviously, we're talking with Paul Seegert, healthcare expert. The problem with this, obviously, is that the fine is too small. And I think if you back this out and you look at it at a larger level, the fact that we have to fine a provider of services to customers for not telling those customers what it costs tells you everything that's wrong with the healthcare system. Because if Best Buy, and I keep using them as an example, but name your big box store, wouldn't tell me what a 75-inch TV costs unless they asked me all these different questions, I would go somewhere else and buy it. I would just
Exactly.
go somewhere else and I would buy it. I'm the consumer. I choose where to spend my money. Our
Exactly.
healthcare system does not work like that. So, the gut reaction is to say, we'll charge them a higher fine so they comply. But that really still is escaping the real problem here, and that is that we even have to fine them in the first place because the consumer has been so far removed from actually being able to make decisions about the most vital thing in their life, and that is their health.
Yeah, and we've taken a fifth. When Medicare was started and Medicaid, healthcare represented 5% of our GDP. Now it's a fifth of our economy.
Right.
A
Wow.
fifth.
Jeez.
And you've taken a fifth of the economy and said, you all can make your own rules, essentially, as an industry. So just make them however you'd like to favor you, in your favor, and just run wild.
Yeah.
And that's what's happening. But let's play this conversation forward and say, okay, they all do comply. Everyone has access to quality or cost information, and we even go a step further and give quality outcomes and ratings to the consumer. This is what we need to do, and we are doing it one plan at a time. When we build custom health plans, we can do these things. So it's working today. It's just not system-wide, unfortunately, but we'll get there, not through political. I don't think through good politics. I think it's going to be one employer at a time, and it's going to have to be the employers who do have skin in the game and pay for these plans,
Right.
That are going to drive the change. But let's say we did all that, and you have quality and cost information. Then my question is, or the next step we have to take would be creating a system, a payment model, and it could still involve insurance. I'm not saying insurance is out the window, but the payment model would need to reward those consumers for making good decisions. And when we build custom health plans, we do that. We'll arm them with the consumer with the information, and then say, hey, if you choose to go to a high quality, low cost facility, we will waive your out of pocket cost.
Right.
You will have no deductible. And you can afford to do that when you're running a health plan. It can make a lot of financial sense to do that if you can, when you see that swing in cost from $700 to $7,000 for an MRI.
Right. Yeah, that makes
You don't
sense.
need their deductible.
That
The
makes
deductible
sense.
is just an obstacle to getting, kind of just saying don't go to get care.
Yeah. Yeah, that makes sense. But this is crazy. I wish I had more time to talk about it, but the bottom line is we need more free markets in the healthcare system, and
That's
I know
right.
that's what you're fighting to get to, because by revealing this information, it's going to make people start asking questions. So definitely appreciate your time today. Thank you so much, Paul Seegert. It's always good to talk to you.